we can share that with Robert and Leah. Thank you. Next slide. Okay, so then I have the pleasure of introducing our presenters today, who come with a vast amount of experience. So I'll speak to Mr. Joe Ryan, who's our National Director for Public Involvement, Culture and Risk Management. I'm sure a lot of you will know Joe, who currently serves as the National Director. His work entails very much working collaboratively with our patients, service users and colleagues across the HSE to drive patient and public involvement in the co-design and co-production of health and care services. Joe leads the organisational culture function to support the wider system in developing and promoting a positive, high-quality, patient and public-centred service culture. And Joe is also our HSE Chief Risk Officer. So Joe and his team lead and support the emerging regions and national centre in terms of risk management, compliance, data protection and protected disclosures. And in his spare time, out of interest, it's always nice to know what our colleagues get up to in their spare time. He volunteers as an emergency first responder in his local community north of Dublin. We're also joined by Margaret Stone, who's HSE Culture Lead. Margaret is a culture transformation leader, change maker, project manager, and believer in empowering staff through social movement to shape the desired culture of our health service and by translating its chosen values into behaviours. And you'll hear quite a bit about that today. Margaret has extensive experience of working in the professional development of on the professional development of individuals and teams through learning and development programs, coaching, and in the past 8 years as culture lead, enabling organizational culture programs to be delivered at scale across the HSE. She's a social management change leader and viral change fellow with specific interest in developing enabling people to their best abilities to improve the health service. She's also very much involved in patient and service user experience, and she sees that at the core of everything that she does, and certainly is a big motivation. She's a public speaker, facilitator, coach, and mentor, and she has a vast educational experience in terms of organizational development, training, and so forth. And she's also, out of interest, a Myers-Briggs qualified assessor and accredited to explore emotional intelligence. So we'll all be on our best behaviour today. And lastly, our third presenter is JP Swan, who's the Organisation Culture Transformation Manager. JP's current role within the organisation is within the Organisation Culture Group, and he leads nationally on the Organisation Culture Development. He's recently completed a Master's in Digital Transformation and is a subject matter on expert on organisation network analysis. He does have a healthcare background as well, so a health, people and culture sector professional with a track record in personal, social and organisational change. He has professional training in social work and cognitive psychotherapy, and he has worked in related roles for many years in the Irish Community Mental Health Services. And during this time, he also developed a series of change projects and social innovations through his development of the social enterprise First Fortnight, Ireland's mental health arts charity. It's very interesting. So it was very interesting to read these. Parallel to all of this, JP is also a skilled media relations and political communications professional and has previously worked in the press office for the Irish Health Services. So we are in expert hands, and I will be handing over as our first speaker, Mr. Joe Ryan. Thank you.
Thanks, Lorraine. And I guess, JP, are you going to share the slides? I'm hoping so. Okay, so look, I'll start just by maybe setting a bit of a scene here. Organizational culture and organizational development isn't new. We have had significant movements in the past and that continue today around developing a positive organizational culture. And I think, you know, one thing I did when I took this role on, it's almost a year ago now, was to say that we weren't going to come out with something shiny and new and different. What we were going to do was build on the many good programs of work around culture and build on the many very good cultures that exist within the complex adaptive system that is our health service. There are many identities and cultures across our services by dint of the fact that we have, a system that was built on many individual entities in the provision of all the different health and care services that we have. So, with that in mind, what we're going to do today is talk a little bit about how culture can enable and can enable positive developments. Open disclosure is a hugely important space, with part of my role being public involvement. It really is an area that when things don't go well, when things go wrong, and when unintended things happen, nearly always, our public just want to know deeply, want to know what happened and how can that not happen again, and how can we learn as an organization. And I think culture plays a huge role in enabling all of us to be able to do that and meet that expectation safely for ourselves and safely as an organization, and adequately and appropriately for our citizens and for our public and for our patients and service users. So I'll move on. So if we just go to the first slide. We have done some work. Is it a finished product? I would say no, never is. You always have to keep looking at your culture statement to decide, are you expressing who you are adequately? The last time this was done was the corporate plan, the last corporate plan. So it's probably about 3 or 4 years since it was done. And the last one was very staff centric. And you might say, well, why wouldn't it be? It's our culture, isn't it? But we felt, having done a bit of work and considerable bit of work with a wide range of colleagues across the system, that needed to be revised to incorporate a wider sense of what our culture should be. It's overly simplistic to say, the if you like, the Virgin Airlines idea that if you look after your staff, to look after your customers, there's truth in that. There's certainly truth in that. But when you're describing your culture, it does behove you to go further, and incorporate the many different aspects of culture. So, I mean, I won't read it out, but I will highlight some of the pieces there that it is a place where the safety and care of our patients and service users is central to why we're here. And it's a place where our staff are supported to operate to their best. It's a place where we treat our patients and service users with compassion and dignity and respect, and we treat each other with compassion and dignity and respect. And I guess this was the area that probably stood out most. And when I've engaged with our board members in particular, they were keen that we incorporated in the elements of culture that relate to accountability and responsibility. And that covers things like operating to the best of your training and your ability, being supported to operate to the best of your ability in your training, and to take, I suppose, responsibility and accountability for what we do each day when we come to work. And that includes even things like productivity, and efficiency and innovation and others. So we try to incorporate all of that. Have we had feedback that says, well, maybe you should change this and change that? Yeah, we do. And that's why I think this will always be something that we refine going forward. Okay, you want to move on? Thanks. Yeah, there we go. So Anyone in the open disclosure space will be familiar with this particular slide. We've shamelessly taken it from you, and you know it. What we've tried to do in preparing for today, and actually when discussing the organizational culture enablement framework, we have been looking to see how, you know, how do we know whether or not our culture is improving or not? And how do we know whether this framework is enabling key elements of what we're doing? And we see things like open disclosure as being a really, you know, high profile, hugely important um, indicator of our culture. Our ability to genuinely openly disclose and engage with families and with patients and service users and our public around the delivery of our services, when it goes right and when it doesn't go right, and to be genuine and honest in that, I think is a huge indicator of our culture. There are other indicators, and we can talk about those. The guys will talk about those later on. But this, when I looked at this, and when I said, you know, how are we enabling this through the cultural program? And I think it is about, you know, key elements will come up around psychological safety and leadership and management and support and commitment. Part of the reason, and you know, I spent a good deal of my life in project management and manufacturing and other areas before I came to health almost 20 years ago. And they talk about projects that fail, and they, you know, the biggest reason they fail is leadership. Okay, is losing focus, is getting distracted by something else, whether it's politics or new service developments or, you know, financial crises or pandemics or indeed cyber attacks or all of the other things that distract us away from what are hugely important foundational stones in building a modern, caring, safe health and care service, and that is culture, and things like open disclosure. So that continuity of commitment, of senior leadership commitment to this is crucial, and I think we have to ensure that we're supporting that from the cultural framework point of view as well. Just want to move on there. Thanks, Chippy. So when I thought about it, and there's probably more, but when I thought about it and tried to think about what would be the key cultural framework enablers for open disclosure, I think that clear and consistent leadership, supporting our teams and staff in feeling safe, and supported in disclosing when incidents occur. I think a working environment where psychological safety is the lived experience. I think we've a way to go in that. There's not a huge amount of evidence, but there's plenty of anecdotal evidence that exists, and certainly from the many discussions that we've had with a wide number of teams right across the country, that psychological safety is very often, and possibly too often, cited in the negative in terms of feeling supported and feeling safe in doing that. And legislation alone isn't enough. It requires our leaders and our managers to purposefully approach psychological safety and ensure that there's a psychologically safe place where not only can we do open disclosure, but indeed where we can speak truth to power. It's important. It's you know, the aviation industry figured this out many years ago, and it's a really key element in having safer and better and more accessible health services. And I'll talk a little bit more about that, and where we're going to produce supports and tools to aid our teams, because it is a two-way relationship, and I'll talk about that in a moment. And I think then the third big enabler is having a strong prevailing culture that's based on our values, you know, care, compassion, trust, and learning. I noted on the open disclosure side, it says care, compassion, trust, and empathy. And we would say, look, you could come up with more than 4 values, but actually we think the 4 we have incorporate all of that, including empathy, and that we drive those values through our system by our behaviors. And Margaret and JP will talk a little bit more about why behaviors are so important in all of this, and how that it makes it much easier for us to translate some of the ambition of our values into reality when we're delivering services on the ground. If you move on there, thanks, JP. So a key part of what has been missing in the past, in relation to, I suppose, our culture program is, and if you like, a matching movement of leadership change, of culture change in our leadership. And we have been working very closely with Professor Michael West. He's been rolling out an excellent program of work with our clinical directors around compassionate leadership. When we read the book, it was incredible just how compatible the Values in Action program that we have had in our health service for a number of years is with compassionate leadership. And I think we identified that the bottom-up movement that Values in Action was very much associated with needed that corresponding level of culture change and consistent culture change in our management and leadership programs across the system. So we'll be working with Michael to not only build on some of the kind of master's level type of work that he's been doing with the clinical directors, and indeed our master's programs in our management development through our colleagues in the Chief People Officer's office, but also we're looking to create accessible programs to help the many thousands of middle managers that we have, who are so important in terms of fostering positive culture within our teams. And I think that's another key difference that you'll see when the guys talk us through some of the detail in a moment, around the approach moving from very much what was an individual contributor to culture to how we can actually build teams that change our culture. And we are a massive team of teams in our health service. And what we have to do is identify the people in those teams who can lead that change. And they're not always the managers and supervisors and directors. They are oftentimes our colleagues, who are natural born leaders within our system, who can really influence others in changing our and developing our culture. We just move on. Thanks. So, excuse me, sorry. So that compassionate leadership is about a collective leadership. It's about enabling all to lead. It's about shared team leadership. It's about, working across boundaries, and sometimes when we're talking going to an integrated care model, our boundaries are our own boundaries, between our own services, whether that's primary care, disabilities, older care, mental health, acute care, even within the acute care, integrating our services within that. But it actually goes beyond that again. We're part of a society in our health services, and so working with our county council and city council type colleagues, working with other agencies like Garda Síochána and others, is an important part of us meeting, if like that broader civic and social responsibility to deliver public services. We can't do it alone. We do it best when we bridge some of those gaps. So that there's a big ask on us as an organization at the highest level, but also at every level in the organization. And in fact, it's happening. We know it's happening. I sit reasonably frequently on looking at some of the Health Excellence Award applications, And we see where people within the system are leading. They're leading. They're reaching out and they're working with local councils and they're working with local education providers to build integrated services right across our services, whether that's youth mental health or autism or other disabilities. We really see where there's great integration, and indeed with the voluntary organizations, organizations like Alone and some of our other large voluntary organizations, to provide really, really fabulous integrated services. And that means, stepping out there and having a culture that's welcoming and that's open, and is focused in and around our patients and our service users, which is why we're here. So we might just move on then, if that's okay. So on psychological safety and accountability, we are developing a model to support the system and to support our managers and leaders in particular in their responsibilities to create psychologically safe spaces. It always pays to think about, and this is just a view, psychological safety and accountability being in balance. We can create, really individual managers and leaders can create, and indeed team members can create a psychologically safe space, but it requires, a commitment from all people involved, whether it's staff or managers, that when we create that space, that we get the best possible result out of that. And I think, if you have just high psychological safety, you've got trusting relationships, you've got safe learning spaces, that's good. If you've got high accountability on its own, then, you end up with, there's a real pressure on people, but it may not be psychologically safe for them to work in that. But when you have high psychological safety and high accountability, you really create an optimized environment for people to learn, and indeed for the organization to perform. So I think just as we roll out that particular support program, I think that's a key element. It's a key element of us having a positive culture where people have the ability to call out and say, actually, we need to do differently. We need to do better, and to be safe in that. But to provide that safe space, you have a responsibility to do that, even as a staff member calling it out, to when that space is provided for you, that you operate in an accountable way, that it's not just provided and there's a quid pro quo on us all to behave responsibly and to be accountable for our behavior in that psychologically safe space. And I think that's one that does have a resonates when we start to talk about open disclosure. So that's me setting the scene, I guess. What I'll do now is I'll pass over. I think, is it yourself, Margaret, is going to take it from here on behaviours and why behaviours are such an important expression of our values and indeed of our culture. Thanks, Margaret.
Thank you. Thanks, Joe. JP, you might move on. So JP is going to bring you through the enabling framework there shortly. Some of you may be familiar with some of this language if you've been involved in values and action in the past. I'm looking at the chat and the hellos there from people. I know I recognize some of the names. We've taken the values of care, compassion, trust and learning and translated them into behaviours. So why behaviours? And you can see this. I miss you telling this story, Joe, because I love the way you tell this story. But it's the grandfather, the dad, and the little child, and they all copying behaviour. I think if all of our screens were on, if I reach for a glass of water now, everybody else would probably do the same as well. We're copying people. I love the way even on the chat function somebody mentioned sunny weather, and then another few decided to point out that it was sunny where they were as well. So I resisted the real capital comment myself. So we learn our behaviours by copying those around us, and it starts at a very young age. So that's where we come with a behaviours-based approach, and behaviours shape culture. JP, you might go on there, please. So it's a value-based, behaviour-driven culture, and we would be asked from time to time, where do the values fit within that? But actually, if you look at the behaviours, which I'm going to go through in a moment, you can see care, compassion, trust and learning all over them. You can also see care, compassion, trust and learning all over the 10 principles around open disclosure, and where it's enabled and not enabled, which I can go through in a few minutes. Also, it's a consensus on our core behaviours is the starting point where we're talking about. And I'm just going to show you the original 9 behaviours. When I say original, so these were developed back 8 years ago now in the Midwest by a project team, review of surveys. We had a number of consultations with staff groups and service users, and the project team then came up with these 9 behaviours, which some of you will be very familiar with, and I'd love if you put up in the chat function if you have been involved in values in action in the past, and if you have put them in, worked with the behaviours and whether they were useful within your team and within your service. And we can chat about it some more later on. These original behaviours have now been developed into 20 behaviours. So the 9 behaviours have expanded to allow for a lot of what Joe has spoken about already, and putting the patient and service users at the very front of this. So it's patient, service user and public. We have had a number of focus groups already, and when we go out into the regions, we will be doing this again. Sense checking these behaviours, whether it makes sense, whether it's something that works within your region. But just to go through them, and I can see the crossover very much so with the work around open disclosure. Do I use my name and your name? Coincidentally, I'm just out of being a service user in the last hour. I've just used our service, and I'm just kind of reviewing it while I was in the waiting room, and I can say that everything in the left-hand side of the column I experienced, which was lovely to see. My name was used, they introduced themselves, people took time, even though there was a busy queue, people took time with people. The now and the next, constantly that's coming up on surveys and feedback, and those who are tuning in today will know this because of the work they do. We're not the best at the next, you know, sometimes not so good with the now, what's happening, and engaging and including our service user in giving them a voice, and keeping them involved with what's happening, keeping them informed. So do we need this as a behaviour? Yes, as the feedback. Yes, we need to name it. And yes, we need to share stories of where this happens and exemplars of where it's happening, so others can copy that behaviour as well, and that it becomes the norm everywhere. Do I regularly do an extra kind thing for the people I meet? So we're as a nation, I think we tend to be kind people, but it's the extra kind thing, the bit that stands out. I looked, because I was up in the city today, I had to find an office space, and the security man in the hospital found an office space for me. That's an extra kind thing. He could have said no. So that's just a simple example. The truly listening, have I listened, heard and responded to the person? So that's deeply listening, and taking, you know, that doesn't have to take ages, but showing that we have listened truly to the patient service user and responded to them, that they're important, that we see them, and engaging in a professional and considerate way. Then when we look at the area around ourselves, this is around self-reflection, and it's encouraging self-reflection. Am I putting myself in other people's shoes? And you know, again, that might sound straightforward, but particularly in a challenging interaction, this one's really important. Why is this person maybe becoming upset, irate, whatever it is? Where are they coming from, rather than looking at it through your lens? So that's the purpose behind that as well, to really push our own self-reflection around, are we considering where the other person is coming from? Again, am I aware of my own stress and how it impacts others? I just noticed this morning on LinkedIn, there's a new module up on HSE land, if anybody wants to have a look at it later, but there's a great example of application of the behaviours. It's within the Northwest Mental Health Services, and they're using the behaviours as a training module for staff in terms of how they interact with carers and with patients. And one of the key pieces they're looking at is being aware of our own stress and how it impacts others, how we show up to work, how we appear in front of people. I use the word stress sneezing. Do we stress sneeze on people, or do we maintain it? Do we look after ourselves? And on the other side, then within the leaders and managers piece, you'll see as managers, as leaders, do we support team members in managing their stress? So there's a responsibility on both sides there as well. Am I aware that my actions can impact on how other people feel? So again, how we turn up, that's impacting others. We're probably all familiar with days when we might be in the office and maybe somebody who isn't adding to the temperament of the office mightn't be there. There's a different atmosphere, there's a different way of working. So am I contributing or taking from that energy within the office, within the hospital, within the services? Again, this is one of the new ones again. Am I working to the best of my training and ability? And where that fits in with open disclosure as well. Am I learning from incidents? Am I learning? Am I putting new processes in place? So it all aligns with open disclosure. Do I use health service resources in a way that reduces waste and improves sustainability? So that's all ourselves. Then moving on to our colleagues, and that guides how we interact with our colleagues, acknowledging the work of my colleagues. We're not working in a silo. I think in the main, people are really good at doing that. There's some really fantastic teams out there. There's also dark spots within those teams. And likewise, there may be teams that don't gel as well together. And there's also light spots in those teams. So how do we support that? How do we help people come out of that and look at how we can support each other? And that is challenging. I acknowledge that is challenging in today's world. But in teams, that's what we're aiming for, and having culture leads within teams, hopefully that will be supported. Do I ask colleagues how it can help? And do I challenge toxic attitudes and behaviours in the workplace? So again, it's looking at bringing the balance, looking at supporting our colleagues. And this one comes up quite often around challenging toxic attitudes. People are afraid of this one. We're not necessarily saying take on the bullies in the workplace, and we're not necessarily taking on the hard bits, but it's bringing balance. It's bringing balance to team meetings. If a conversation is happening that isn't conducive to the meeting, that somebody brings balance to that. And the feedback that we're getting around this behaviour is that staff feel they have permission to do this, that it's not somebody else's job, and if everybody ignores it, it will continue. And it's named in the behaviour, so that's visible around the place. This is not how we work around here. We challenge toxic attitudes. So having the behaviours up in your team rooms and around your services is what we will be aiming to have, so that you can reference them. Do I lead by example with my peers? There's actually a lovely, I don't know if anybody's familiar with the Hush Foundation. Professor Catherine Crock is over from Australia and Cork this week, doing a number of workshops. I'm attending one of them this afternoon. I see we've somebody here from Heather House. I think she's up with you guys tomorrow. And she has introduced within the hospital she's working in Australia, huddles before. She works in paediatrics. She's a consultant in paediatrics. So before any patient comes into the theatre, she gathers everybody around for a huddle. And she has a very psychologically safe environment where no matter your role within theatre, everybody gathers around. They have a huddle around what's happening, how everybody is feeling. And it's just her examples are fantastic. I'll put up the link there in a while, but it's the Hush Foundation. And they're just doing some fantastic work around leading by example, learning from mistakes and so on. So a lot of the behaviours are kind of covered under that. and working with our colleagues to improve our service. And that's key around open disclosure. You know, it's around reporting. What are we doing after the fact? So there's the firefighting, but are we making a difference afterwards? Are we returning to it to see what we can do different around our processes? How can we work with each other to improve the services? How can we work with each other to avoid it happening in the first place? And do we have that safe environment to do so? The leaders and managers is the, I suppose, the big addition to these set of behaviours, these 20 behaviours. And it's putting leaders and managers front and centre. In the past, those of you who will be familiar with values in action will have heard of backstage leadership. And I think that would have been misunderstood in the past, that leaders would have taken a backstage role. The role would have been to enable the champions or the culture leads in their areas to spread culture, spread the behaviours. Now there's a very clear, distinct call out for managers around their responsibility for this to happen. And that's starting at the top as we're meeting with the regional senior leadership teams around the country as well. So for leaders and managers to value and acknowledge the good work of my team, supporting team members in managing their stress. So there's a responsibility and a role there as well. Addressing toxic attitudes. So with ourselves as colleagues, challenging toxic attitudes in the pale blue, but that managers need to address it. It's not somebody else's job. There's a clear managerial leadership role there as well. Appraising and addressing underperformance in a fair and compassionate way. We've actually got some really nice feedback in the past that people have used the behaviours for that, for performance meetings, working through the behaviours. It's a nice kind of gentle way to give feedback as well. So that's a useful tip. And as we go out through the services, we'll give more information on that. And supporting our teams to innovate and improve our service. So it's constant innovation that we're looking for, an improvement. And do we give the space to do that? Do we give them permission to do that? Do we have an open, safe place for it to happen? Okay, so that's the 20 behaviours, and you'll start to see more of those as we get out across the regions. And JP is going to explain the process now with which it's going to be rolled out right across. JP, I'll hand over to you.
Yeah, thank you, Margaret, and thank you, Joe. And thanks everyone for staying with us so far. The process has had a lot of thought and a lot of engagement, discussion, deliberation. We've been out with many and varied parts of the organization, and as Joe kind of stated, we're still out there, even though we've a very considerable piece of work done. Culture is a living and breathing thing, and I think whatever framework we were going to try and adopt needed to be sufficiently clear so that people could make progress, but sufficiently flexible so that the progress that was being made could be adapted to, localized, and made meaningful where culture resides, and culture resides primarily in teams. That's that we are, our culture more can be understood best, I suppose, as the sum of the culture of all of our teams. We have stated what our desired culture is, and Joe was very clear kind of on that. And the challenge, or in other terms, the gap analysis is, well, how do we get there? How do we get from the desired culture, the thing we'd like to see most in all of our teams, to the reality and the norm in all of our teams? And Margaret was really clear, I suppose, that you can do lots of things on culture, but one of the most efficient things you can do is to focus on the behaviors that are happening on a daily basis everywhere in the organization, and try and seek some degree of clarity and consistency among our teams, among our peers, among our colleagues, that when we're at work, we're a bit like this, and this is the kind of way we like to be in our team. So that said, in order to bring those sort of ideas beyond, nice words and good sentiments and things that make you, feel good and positive, and it should do all of those things, there's always the question, how are you going to do that? How are you going to bring that notion, that sentiment, to some sort of practiced reality in a very large organization. So I'm going to hope to sort of walk you guys through some of the main elements that we feel will support and buttress the enabling framework for culture, but frankly to buttress the organization in efforts to develop the culture of choice, to develop our chosen culture. I'll also jump in, I suppose, with some specific thoughts about maybe some relevance where I see important practices like open disclosure and how a culture that's based on behaviors and the normalization of those behaviors can help to normalize challenging at times practices too in teams. That when you start with the bedrock of behaviors that form a good culture, you maybe increase the likelihood where something that's important but not always easy to do becomes more likely to get done. So we'll start at the beginning, and I'll sort of point that out along the way, and hopefully probe some thought and some questions that you guys can give to us when we stop talking and you guys start. Okay, so senior leadership teams establishing a culture of governance. So look, it's important that we understand this is happening right now. So this is not all aspirational. We're currently working this plan as we speak with the new regional senior leadership teams. We've been meeting with them fairly consistently and setting out, you know, I suppose that question of ownership and leadership and placing some degree of order and accountability on what's going to happen in our regions and how it's going to get done. A pretty consistent message has been coming from those senior leadership teams that they feel culture is a priority and they want to hold its governance at their senior leadership team level. That's good news. You know, again, we weren't overly keen to prescribe that. There is an option where people could have broken that off and said, you know, we'll establish a separate culture governance group. But our preference has frankly been their preference as well, which is that if we're going to be real about it and that culture is going to remain a consistent priority for our regions, it's really good that in our new regions, culture is going to be held as a governance area that the senior leadership teams are going to take an active interest and an active leadership role in. And again, it's quite critical, but it's quite encouraging that that's a good degree of alignment and an agreement on the best way to move forward on that. One of the key things of that culture governance is that, you know, we're of the view that you need a regional culture development plan. You need something that people are saying, well, we agree. We want to get towards a desired culture. We agree. We'd like it to focus on behaviors, and we agree we'd like it to be at scale right across our tens of thousands of staff. So therefore, we're probably going to need a plan, because that's, while it's not anything to stop us doing what we're already doing, it's still an undertaking, and that undertaking requires, like any good, you know, piece of work, some degree of order, some degree of planning. And again, the contents of that plan is being discussed and being deliberated, and we will continue to support those discussions and deliberations of that planning process. And what falls inside of that plan? What are the key culture enabling actions and factors outside of you know, just the behaviors being promoted and enabled? You know, what more on top of that as well? You know, what more on top of that is required? What more will help maintain that culture? So that plan those plans will continue to be developed over time. And any thoughts you guys have on what sort of things might need to fall inside that plan from an open disclosure point of view? Is there areas work that's already commenced that would be relevant, that would be helpful? Are there people particularly who are trying to progress open disclosure among teams and so on that could be helped and enabled by something like a local culture development plan, and what might need to go into it? Again, we're really open to that, and I'm sure the regions will be too. Where things are enabling culture, we need to keep an open mind that maybe these things need to be part of the plan too. With that in mind, though, I suppose we are also thinking that the region, you know, the regions are pretty vast. Our organization is pretty vast. The scale of the organization, maybe I need a better line, but this is the one that always occurs to me, is that, you know, to put in context the size of the HSE, if the HSE was a city, it'd be the third largest city in the country. It'd be Dublin, Cork, HSE, in terms of the sheer volume of population. Okay, so When we put that into context, it becomes easier to kind of grasp the numbers of people, the numbers of different personalities, the number of different people with agency, the numbers of different people doing different jobs. So in order to make sure that we've got something that's looking like it might be able to localize in a meaningful way, we think each region may need a one or perhaps a number of localized culture teams, people who are coming together to help operationalize the key aspects of culture development and of the culture development plan. And who maybe falls inside of that may well be people who've already got key deliverables that they're trying to get done that are really relevant to culture. You know, that could be something that's digital, a big change that's coming. That could be a national policy that needs to find a local home and be progressed. So again, we're not necessarily talking about starting something entirely new. We're really keen that whatever regions do sort of harnesses the kinds of people that are already at work in developing culture through practices, but that it's a more connected effort and it's a more falling within the guide rails of a framework. The next bit, I suppose, is just key for us all to understand, and some of it we're doing today, I suppose, is that we really need to start to think about culture development not being a surprise to anyone. It shouldn't be a secret. It shouldn't be a surprise. We should be working out loud and encouraging everybody to have a role in that, everyone to have a voice in shaping it, and everyone to find a way to play their part, because it's not our culture, as in the organizational culture units, groups culture, or Joe's culture as the national director, or the CEO's culture. It's fundamentally needs to be the culture of the organization, and really the culture of the teams of the organization. So we're here to enable it, and by enabling means we need to talk to a lot of people and involve a lot of people. So it should never really be a surprise. So meetings like today are really helpful in part of that, and we're really keen to keep an open attitude and a work out loud attitude on the development of this. So any ideas and thoughts that people have about anything they've heard this morning, do please pop them in the comments. Do formulate a question. We will have time to respond either today or again into the future if it's something that's slowly percolating for you. All that said, though, all of those blue dots you saw to the left-hand side are all in the somewhat familiar territory, right? To do anything good, you need a plan. To do anything good, you need support. To do anything good, you need leadership, backing, and some degree of resources. But again, that's very much in that sort of top-down space where we can imagine a lot of progress getting done with a small number of people. When we start to get to this middle arrow here, why is it not shaking? Anyway, the orange dot in the middle, as you see, is really, I suppose, that phase transition from something small turning into something very large scale. It needs to move from you know, a policy or an ambition or something that someone has said to actually a participatory function where teams are actually involved, where teams on the ground have people that they're identifying and nominating, you know, through planned processes. And we do have some very clear processes to help, you know, the organization find the influential staff across the network, find their most connected people, find those natural leaders Joe was speaking about. But they need to fall within teams. They need to fall within areas of work where they matter. It's not about taking people away from their teams and talking about this high notion of culture. It's really about finding people where they are, and how, if there is a chosen culture, how they might lead their team to a consensus on that and change what they do in their team. And if we find enough of those people in all of our teams across all of our regions, well, then we can start to see how that scale-based consistency starts to grow, and we start to see this kind of movement towards, you know, health team culture, movement towards a values-based and behavior-driven culture in our teams. And people start to see each other in what they're doing. Oh, right, your guys are doing that in that way. That's interesting. Remember, there's all sorts of informal connections way across our system that are much that are even harder to find. You know, if you imagine it's going to be a sunny weekend this weekend and a barbecue, whether it's in Longford or Carlow or Limerick, you know, where people are meeting people that they know. There's probably a few people there who both work in the health service. Maybe one is a nurse in disability. Maybe one is a manager in mental health. But if everyone has a similar vocabulary about culture, well, it gives, I suppose, a different flavor of how people interact, right? Often you can imagine those things are often where we moan about work and we go, God, I couldn't get this over the line, and God, I couldn't get that. You know, if teams are starting to feel different, then everything starts to feel different. And we can kind of, in a not too distant horizon, start to see how, well, maybe being in a bit more control, maybe being of our own teams rather than the national leadership or the regional leadership feeling that need to control teams, might actually be the most sensible way to go forward with culture. So that sense of community, of effort and collective effort is really, I suppose, stitched into what we'd like to see come forward across the regions and across the organization. The ultimate goal here will be that there's a degree of normalization of the culture, where we start to see a predictability, that if someone moves from one team to another, that there's no great emotional wrench in that, right? That you can sort of start to predict if there was a good culture in one place, well, there's probably going to be another good culture in that place as well, because a lot of those people are working on their culture too. It starts to bring up the water level of where we kind of see the good culture in the organization. It starts to help, I suppose, move away from those pockets of darkness and those areas of light that Margaret was mentioning, where we could start to see, you know, the whole culture is a bit more illuminated across our entire network, and a bit more predictable and a bit more practiced. That doesn't mean to say it won't be different. Culture teams are going to be different by dint of the fact that they all do very different work. So even though that normalization is going to occur, different teams will focus on different things. And again, within the framework, we've been really keen to kind of emphasize that teams should have really their own culture beacons. It will be helpful that they focus on what really matters to them and what they're trying to do. Is it the learning aspect of the values? Do they need to make more efforts to learn as a team, to be open to new practices, to be changing how they go about their work, or reflecting on that, or studying? Equally, you know, there are going to be other aspects of the organization that are going to start to impinge on that, open disclosure being one of them. It's so, and this is, I suppose, just to call out a thought here at the moment. Often we're seeing an awful lot of culture mentions in many different aspects of the organization. Often we see it highlighted in reports after something has gone wrong. Now, if we're identifying a discernible pattern where many people are seeing the culture in the team as a factor in some harm occurring, or something happening that everyone would rather did not happen, or something that was making the public unhappy, or something even, you know, more challenging than that requires a very special attention due to a major safety issue, whatever those kind of things are, frequently the item that comes up as one of the contributory factors is team culture. So we could ignore that, or we could say, well, actually, does good team culture, based on a chosen culture, based on the behaviors that we've set out, actually reduce the likelihood of something not going how it should? And does it increase the likelihood of people being able to manage emotionally challenging adult-to-adult conversations that sometimes need to happen in healthcare? That makes something like open disclosure a bit more likely. That makes something like having owning an error and learning from it a bit more likely. Again, we're of the view that culture gives you the bedrock, whereby other aspects and challenges can find a more welcoming home, rather than being seen as another thing that adds to the challenge of already feeling like you're challenged. The last piece I'll kind of draw reference to here is, and really you can stitch this right across all of the other elements, is that we are working quite diligently at the minute, but with a lot more work to go on, or to go with, in terms of developing the right metrics for culture for the organization. So very soon we'll be forming a national culture metrics working group. We're really open to every area of the organization helping with that, having a strong deliberation on that, bringing their key metrics in terms of what it is they're you know, looking at as identification points that they're being successful in what they're trying to do, or otherwise, and what any of those metrics tell us about the overall organizational culture. So obviously some of those metrics may well contribute to open disclosure, its likelihood, its frequency, how it's been received, and so on. So again, we're really open to hearing about that and partnering with anyone with some good grounding on that who wants to help us out on on those working groups, because we don't really want to rush this. We want to make sure we get this right in a way that, again, following the overall principle that our metrics are enabling. They help us get data that is going to make the culture more likely to be adopted rather than critiqued or you know, stalled in any way. We want to use the metrics that matter, that are going to help teams get to their desired culture a bit better. But again, we're really open to suggestion on that, and we're really open to kind of finding the right mix on a dashboard that's going to help the teams on the ground to understand where and how they might calibrate in terms of where they are with their culture and where they maybe need to get to next. I think that's us for the moment. I hope I've not gone too quickly and confused anyone, but I think we're going to pivot to questions and discussion, unless any Joe or Margaret, you want to add anything to anything I raised?
No, I think it'd be good if we could get into, there's a couple of questions have come in through the chat, so I know we have Roisin, I think you're going to help us with that. But yeah, and I think we'll probably be able to address some extra bits once we get the questions going.
Okay, well, I'll stop sharing then, if that's okay, and I might allow Roisin too if she needs to. Great.
Perfect. Thanks so much. Thanks, Joe, Margaret, and JP. Really interesting presentations from the three of you. We do have this recorded for people that have joined us a little late. We do have this recorded so you can watch back the full thing afterwards. My name is Roisin Egginton. I'm a General Manager in Incident Management and Open Disclosure, and absolutely delighted to be part of this conversation today. We have had a couple of questions come in from the chat that we'll be addressing, and if we don't have time, we will certainly take them back and be able to share on them after the fact. But to start with, I suppose, just from a reflection piece, as I was listening to you speak, I know I've been working in the HSE myself for just over 20 years. And Joe, you mentioned yourself, you've been in the HSE for 20 years, and that was following a career in multinational technology firms. But Joe, you've been involved in transformation and leadership and changing culture for the guts of that 20 years. Do you feel the HSE is actually changing? Do you feel that culture change is happening?
I do, Roisin. Otherwise, I think I'd be gone a long time ago. The big change I found coming from the tech industry, where I spent a little over 20 years, which tells you I need to retire soon. But what occurred to me was that change is just so much more slow in the public service. And it's not because anyone wants it to be slow. It's just the nature of what we do and how big we are. And I think Ireland has a certain level of uniqueness in terms of that complex adaptive system is really complex, because we grew our health service out of what was originally really, religious order provided, and then county council provided, and there's a whole history to that. Which brings a richness to it and brings a set of really, really strong cultures to it, but also provides a challenge then when you're trying to integrate all of that. So is it changing? Yes. I would openly admit that I learned more in my first transformation job in the health service, when Brendan Drum had the butterflies. Everybody remembers the butterflies from the transformation program. And this is with the greatest respect to everybody that was involved. I think we all learned more about how not to do large scale change then in those years than we could ever learn. And I think so I think huge things have changed in the system since. Huge advances have happened. That doesn't happen in the absence of culture change. And bringing together health boards under a singular national service, going through all of the management layout changes that we continue to go through, and for people still to deliver higher quality services with more people surviving. Our fundamentals in terms of our performance are up there with anybody else. That doesn't happen by accident. It happens by people showing up and doing their best every day. Have we had things happen that we wish hadn't happened? Yes. Every system in the world has that, and that's where we need to keep building that culture. The job is never done on culture. Okay, it's never done. But I think we've made huge progress.
Yeah, that's fantastic, Joe. And I do agree with you, because I think I was one of those people back 20 years ago as a primary care transformation development officer when we were looking at those butterflies. And I do agree with you that we have come on quite a way since then. And it does look like this new framework and the 20 behaviors. And Margaret, I'll come to you next. Those 20 behaviors that will be driving through the change program, I think is really pivotal. And one of the columns you mentioned was me. What can I do around changing the culture? And in our national quality and patient safety function, quality improvement is quite a large focus for us. In quality improvement, we often say, what can I do by next Tuesday? If we want to create the agency for change, we ask each other, what can I do by next Tuesday? So I suppose my question for you, Margaret, is any of those core behaviors, is there a message that you can give to our upwards of 300 people on our call today? What could people do by next Tuesday to make those incremental changes in culture, would you suggest?
That's a question. I would probably start with assessing what are you doing now before you decide what you're going to do by next Tuesday. You know, have a self-reflection and look down through them. And are we forwarding on the slides afterwards? Will people have access to the behaviours? So I know, Joe, you talk often about checking in the morning and checking in the evening. But yeah, just having a quick sense check of where we are at. When I started working this in the early days, I remember a public health nurse sharing the story with us. So forgive me if anybody's heard this already, but the piece, the all-encompassing piece around, am I aware of my own stress and how I deal with it? That's it, not even next Tuesday, that's this evening. You know, are we spilling over into our workplace from home to work and vice versa? Are we taking it out on our family and our loved ones when we go home when we've had a hard day? So there's a knock on there. And I recall a public health nurse sharing a story of, you know, somebody had printed off, you know, one of the thumbnails of one of the behaviours, and they had stuck it on the dishwasher in a public health, one of the old health centres, you know, the small ones that are at the side of the road that are few and far between now, hopefully. But it was a public health nurse. She was out at 7 in the morning. She was caring for somebody during the night at end of life. And went into a very busy clinic, and putting herself in the shoes of the people in the clinic who saw her coming in late, stressed, and her colleague wanted to hand her in a cup of coffee. She knew she was having a hard morning, but how that appears to the public, here she is, you know, getting a cup of coffee when she's got a big waiting room. And her colleague turned it around straight away in terms of acknowledging to the waiting room that everybody will be seeing, would you mind if I got a cup of coffee for my colleague? She's been out since half the night, etc., etc. And people just changed straight away. So it's the now and the next, explaining the now and the next to the waiting room. But that lady was saying that evening, she continued to have a bad day. Coffee helped, but like didn't turn her day around. But she was putting the cup into the dishwasher that evening before going home. And she spotted, am I aware of my own stress and how I deal with it? Now, she was about to erupt at this stage. And then she was thinking, oh, I forgot to take the chicken out of the freezer. There'll be no dinner. The homework has to be done. And that the behaviour stayed with her on the way home. And she stopped her car before going around the corner into her driveway and said, okay, I can change this. I can turn this around for myself. And she decided not to be super mum, order pizza, watch a movie. What was done was done. It was good enough. So it's working through. It's a work in progress constantly. And from a coaching perspective, I always say, where are you hitting each one of them now, from a 1 to 10, and then what's the gap? What can you do if one of the behaviours is a 6? What can you do to make it a 7 by next Tuesday, as you're saying, Roisin? So first thing you need to do is look at where you are now before you work on it. Sorry, that's a longer answer than you probably expected.
No, it's a beautiful answer, Margaret, and it really touches at the heart of it, doesn't it? Like that story really does. And it brings home, I think it's a comment in the chat as well from Helene O'Reilly. I think the success of culture change is education and engagement to take place at the local unit level. And I think the modeling at the local level is going to be so key from what you're saying today to drive this change of culture and the focus on our values. There was a
Just
couple
maybe
of
a comment
comments. Yes.
I'd make on that, Roisin, sorry.
Yes, Joe, please.
It was a really welcome comment. I think that's where we're going with the identifying through the organizational network analysis, identifying those local, natural born leaders, if you like, within all of our teams. And as JP was saying, not to be extracting them out to do something over here. It is really to, if you like, imbue and infuse some of the tools and capabilities so that teams can start to build their culture. And I did notice another one of the comments around, it can often be where the leaders aren't playing their role, in tackling toxicity and again, to go back to that analogy of, there are many, many, many light places that have fabulous culture. There are many places that have, darker spots and the culture isn't good. And it is about growing those, naturally growing those light spaces, okay, by identifying people in our teams, by leaders, by the very top of this organization, all the way through, driving those behaviors. We drive the culture, we shape our culture by those behaviors. And there are other things that get invoked to help with that. The more procedural, mechanical things outside of the idea of growing a culture. There are things like protected disclosure that we are trying to improve. It's part of my body of work that I'm responsible for in the HSE, that we're trying to improve that assist in this. They're not meant to be the big lever or the fulcrum, but they're meant to assist where teams can't naturally grow that and improve that culture, where they meet that resistance, where that impenetrable barrier exists, be it with a leader who is in and of themselves operating in a way that's toxic or not helpful. So I think we have to look at the system in its full range of things that are available to us to improve and to make culture better, and that happens best locally. But it also meets some of those barriers locally, and it's incumbent on leaders to drive this through. I think that's the key message I'd say in response to that. Thanks.
Yeah, no, that's a very good point, Joe. And taking from that, we've been talking a lot about the individual's response and the individual's drive for creating this new culture. I shouldn't say new, because Joe, you said it at the very outset, this is not brand new. This is driving what's already been built on over the number of years and taking it that step further. So one of the questions that did come in is looking at it beyond the individual, that a lot of the structures we've established in the HSE are around either the health promotion and the preventative side, or on the rehabilitative side and the employee assistance programs at the other end. But when we're looking at systemic stressors and whether it's a system that is driving that psychosocial stress, and I suppose, JP, I might be pivoting towards you on this. You were talking about the top down and the bottom up approaches that we're looking at driving with enhancing the culture and the new framework. How can we look at addressing the systemic, I suppose, challenges we have in creating the culture where we want to get to?
Well, look, I mean, again, I suppose we've tried to answer this in the frame of teams and teamwork. Okay, and we're trying to elevate, I suppose, almost the cultural psyche, the notion that we are an organization of teams and we have a culture that is the sum of the culture of all of our teams. And when you start to break it down like that and ask the question to teams, well, what's your level of autonomy? What's your genuine answer to the question of what's your level of autonomy? I spent many years working in the community mental health and multidisciplinary team. And, the culture was we met on a Monday morning. That was our MDT meeting. We met on a Monday morning. the culture entirely excluded our crisis home care team, who worked all weekend and didn't work Mondays, and we're working with the most unwell people in the community. But it suited all the rest of us to meet on a Monday morning. And in truth, those patients who needed most of our attention got least of our airtime. There was no national diktat that said we meet on a Monday morning. That was, the consultant, the regs, the AA suiting ourselves, because we were Monday to Friday people. So, we always had the autonomy to make that change, and we did. We changed it to a Tuesday morning, and the meetings got much more productive. But I suppose my point being that was always in our gift to change that. The question was, who was empowering us to actually have a dialogue with each other? What was our standard? What was our relationship in terms of how we talk to each other as peers? What our consensus is on how we do things around here. So, the necessary level of autonomy at the necessary level of authority is often the means by which you can start to understand what you can do for yourself. And it's really important not to exclude that, because we're talking about very well trained people. We're talking about very well educated people. It can often get very insulting when we kind of surrender to the orthodoxy that we're such a top-down organization. Well, we are and we aren't. We are when we look. But often we're not looking. So teams are actually doing all of this often with very little interaction or very little supervision. They're expected that they've got the right level of qualification and training, and they're often just left away at it, unless something goes wrong, right? In which case they get all of our daylight, all of our spotlight, all of our attention. So I think sometimes it's just it's the frame, right? It's the means by which we look at the organization. Do we look at it as a delivery system for health and culture, or do we look at it as the place where health and culture happens? And where healthcare happens, well, that matters most, right? That's our touch point. That's our expression of our culture, how we conduct ourselves, how we serve the public. That happens most meaningfully where healthcare matters. Not how we talk about it, not how we write about it, but where it actually is done. So I think sometimes it's about inverting that frame, right? I'm thinking about, there's no base of a pyramid. This is it. Like the preponderance of the organization is doing that. The rest of the organization should be just enabling that to the standard that the public wants to see done. So, in a way, I suppose it's not rejection of hierarchy. It matters. I get it. I've worked on both sides of the ball. I've been on the corporate side and the community side, and I understand it. But I think it is about, at a very basic level, mobilizing the top down of the organization to a mission of enablement, and mobilizing the bottom up of the organization to a mission of raising the standards of the culture that they can expect from each other, and hoping that both of those efforts lead us all to a better place.
Great, JP, the point's very well made. And I think at the top of what you were saying there, that really we're a system made up of teams, and it's mobilizing those teams. Joe, you wanted to come in as well.
Yeah, just a short one, really. And I think, JP, you've hit the nail on the head on that one. The fix to a lot of this is within ourselves. However, what I would say, and when I was reading through the comments and saw that question and comment, it struck me, having sat on the senior leadership team through a couple of big things that we've had in the last few years, like a pandemic and the cyber attack and others. There's always some, a work stream within those big events, which is around our psychosocial supports, right? Recognizing this is going to be an additional stress on everybody. But actually, there's something for me to bring back to senior leadership, which is that reflection of, we don't necessarily always think about our need to bolster those psychosocial supports and preventative mechanisms and supportive mechanisms just in our normal business as usual. In some places we do, but not universally. And I do think that's something maybe that I'll take from this and reflect on.
Yeah, and the psychosocial supports and psychological safety is a huge part of what we look at in open disclosure, and in leading and driving that open and honest and I suppose just culture that we put forward in our incident management team, our national QPS function. Just one other question, and it's a quick round one really for the three of you, because I'm conscious we're finishing up on time and we have a couple of final slides we want to share with our attendees. But just a quick question. As you've been designing the enabling framework for organizational culture, What's one lesson you've learned that you wish you'd known earlier? Is there anything you've learned as you've been designing this framework? If anybody wants to start.
I might.
Yeah, Joe.
Yeah. Look, and it really was. It was right back at the start. Is that this isn't new? There is so much out there. It might seem like a big hill to climb, but it's not, because there's so much out there already. We have Schwarzren's, we have huddles, we have CISM, the critical incident supports. We have wonderful, wonderful teams doing wonderful things in caring, compassionate, collegiate ways that emerge. 300 plus applications every year for our Health Excellence Awards. Stuff that would just get, tears from a stone, right? In terms of being just so lovely to see, right? While delivering really highly professional services that have fabulous outcomes. So it was actually that kind of pause, look, and appreciate what's out there already. And don't go at it in a way that's saying we're going to preach culture to you. Actually, we know what's out there, and that's why the guys have been so, I think, in this, we haven't been here just to present a thing. What we're here to do is say, please join in this thing and help us improve this thing, because we have as much to learn from the system as we have to support the system with. And it's a living organism, and it'll keep developing. It never stops. So that has been the big one for me.
Yeah.
Yeah.
Absolutely. Margaret or JP?
Yeah, I'd echo that. I think the consultation process this time around has been fantastic. We know that there's a lot of brilliant services out there. I think the consultation, have we got it perfect? No, we're still discovering other people to consult with as we progress. But the consultation started back last November, and I think that's been fantastic, and we've aimed for that before, and it hasn't happened. So the synergies of services around the building of this isn't ours. This is the HSE's framework, and it feels that way. And just the learning for me is like, God, I love meeting people. I love meeting services, and there's learning every single day around the application of culture for me. And it's listening to that and applying it and keep changing, as Joe said at the start. This isn't the framework full stop. This is the start of a process owned by the services, locally owned by the services, and it feels living and breathing to me, and that's the way it should be.
Yeah, Margaret, that sense of ownership of that, I think, is so important for building that agency, that action for agency, isn't it?
Yeah.
And going back, Joe, what you were saying, looking at it from an appreciative perspective, that appreciative inquiry, that safety to mindset, to celebrate how far we've come and how much good we're doing out there. And I think really recognizing that is so important. JP, just very quickly coming to you, is there anything now again, and to ask you this final question, in this enabling framework, is there any lessons learned or anything you would have done differently for you now?
We've probably learned them through the process, but definitely I think the one key aspect of it, which was probably moved from an assumed to an out loud at all times in all instances, is probably the switch to the focus of the role that teams play in our culture. We probably would have seen it more across disciplines or regions or geographies and so on, but the piece that really the consultation made very real for me was that this was it needed to be a team effort. Now, that team efforts don't subsume agency. In fact, the best combination is that where individuals have agency but then commit to that their best version of productivity or is committing to the people that they're with every day, and to work through and with each other. So what else could be more impactful on culture than that? So yeah, I think lessons learned hopefully have been learned in time, but we but in terms of both myself and Margaret and Joe have a very long culture journey. It's over 8, 9, 10 years. So yeah, I'd say in terms of this iteration of the national culture and what we do about it together, that certainly wouldn't be my key learning, and I think probably our key change.
That's great. Thanks, JP. It's been a really, really rich discussion. I'm going to hand you over to our Assistant National Director for Incident Management, Names and Open Disclosure, Lorraine Schwanberg, who'll just say thank you to our speakers today.
Thank you, Roisin. I think my own reflection was that I omitted my own introduction at the very beginning. So thank you. You've addressed that for us. I just want to say a big thank you to our speakers today. Your presentation was very motivating and inspiring, and culture is just such a big element of what we are trying to help support services with and drive within the organization as well. So completely appreciate all the expertise and experience that you have, and trying to reinvent it is not really the ask, but it is very encouraging to see that there is such a spotlight on culture, and that there's that recognition of how important it is within the HSE. So I want to thank you for taking the time out, to Joe, Margaret, JP. I want to say a big thank you to our ISL interpreters as well, Robert and Leah. A big thank you to my team, and in terms of the preparation, planning, organisation, to Kelly, Ellie, Mary, who've been keeping us on the straight and narrow in the background. So thank you very much. Big thank you to all the attendees today who joined us and who contributed with your questions. We really appreciate you taking the time out, and a big thank you to Roisin for so expertly facilitating the Q&A session. And I think you have a few last key messages as well for the audience.
Yeah. It's great. Thank you so much, Lorraine. Yeah, we just have, just before you head off, hopefully out into the sunshine for a little fresh air, we just want to remind you that our e-learning module 1 is available on HSE Land. That is mandatory training. The link is there, and again, we will be sharing these slides afterwards, and there is CPD credits for them. The refresher needs to be done every 3 years. So just a gentle reminder. Our module 2 is also available on HSE Land. It's open disclosure, applying principles to practice, and that is mandatory for anybody who may be part of the open disclosure process themselves, but we would encourage everybody to do it because it's really, really useful learning that you can apply throughout your work. There is the Health Systems Ergonomics and Patient Safety Conference coming up in June of this year. I know our Quality and Patient Safety Incident Management team is going to be co-delivering 2 of the workshops at that event. You can still register, and we hope to meet some of you there. And there might be one more slide. Yes, so the National Centre for Clinical Audit has a number of events coming up in June there. You can see there's QPS Talk Time, which is our fortnightly webinars delivered by the National Quality and Patient Safety Function. There's social media announcements, an opportunity to meet the team in the National Centre for Clinical Audit, as well as presentations. So we do have QR codes you can take down now, or as I mentioned, we'll share the slides afterwards. So we'd encourage you to follow them for Clinical Audit Awareness Week 2025.
Just to say, Roisin, that our Joe and JP and Margaret will be supporting the HEPS conference as well, so there will be an emphasis on culture there again, which we're very grateful of their support with. Thank you.
Yes, very good point, Lorraine. Thank you. And we do look forward to meeting them there. We will be sending you out a very brief evaluation after this webinar, and we really appreciate your participation. It's always ongoing, continuous learning for us as well as to how we can deliver webinars that will support you in your work. So thank you very much for completing it. And then I think the last slide is just a bit of information. If you'd like to connect with us following this webinar, or if you'd like any more information on open disclosure, or you have any other queries for Joe, Margaret, or JP that we didn't address in the webinar, just drop us a line there at opendisclosure.office@hse.ie. So again, a huge thanks to everybody for joining us today. Thanks to Joe, JP, Margaret, Lorraine, and our open disclosure team, to Robert and Leah, and everybody who joined us today. We look forward to seeing you at a future webinar.